During regular hours in this emerge in Oshawa, we would see typically 250 to 300 patients a day.
Ontario hospitals have been struggling to provide beds for those in need, often leaving patients sitting in hallways or crowded emergency rooms for up to double the normal wait time. I'm Nicole Martin at Lakeridge Health in Oshawa, where the hospital has set up a command center to deal with the record number of emergency room visits. Tony Stone, chief of staff at Lakeridge Health, says an increase in volume during the holidays is perfectly normal. This year, however, there seems to be a peak in influenza at the same time as the regular holiday influx.
Influenza surges every winter, so we plan for this every year. We plan for a surge. And we do that by increasing beds, increasing staffing. This year's unusual in that the volume seems much higher right now.
On an average day, Stone says about 250 to 300 patients come through the emergency department. Right now, they are seeing about 50 additional patients a day, so they created a team to help handle the patient overload.
So in order to manage that, we create a surge team with a command center, and they're really charged with finding more additional beds, additional staffing, and then finding ways to make us more efficient so we can free up beds for our sick patients who are waiting in our ERs for beds upstairs.
Now, Lakeridge is not the only hospital struggling to accommodate an increase in volume. It was just a few weeks ago when we brought you the story of a grandmother who was left in the hallway at Trillium Hospital for days waiting for a bed.
She had a hospital gown tucked under her head as a pillow. So I asked the nurse if we could have a pillow and an extra blanket because she was cold, and they had no pillows, not even, and they had one blanket left for the entire emergency.
Lakeridge Health said in a news release earlier today, emergency department volumes are expected to remain high for the foreseeable future, and other hospitals across the province are struggling with similar volumes. Now, Dr. Stone says if you are experiencing mild flu-like symptoms but are otherwise healthy, it's best to stay at home. Moderate symptoms should take you to your family physician or a walk-in clinic, and more severe, prolonged flu-like symptoms require a visit to the emerge. At Lakeridge Health in Oshawa, Nicole Martin, City News.